Base Yaco, Denver here, I was told by very many that like if you want to marry a, very frum guy who is learned and who's a Talmud Chacham and who is going to be sort of the, have the hashkafa and the household that you want, you should not pursue a career in medicine because you'll never get that to all work out. But thank God it all very much did. I got a degree in biology, followed by following my husband to Baltimore, where he was learning in Mary Stroll. I worked at the National Institutes of Health for a couple of years, where I did some research between my bachelor's degree and medical school while he was learning. And then we moved to Israel, where I pursued my medical degree. Following that, we returned to Denver, which is where I'm from. And I did my residency and fellowship here. And then I've been at the same hospital. I finished my training about 5 years ago, and a year and a half ago, I was put in a. There were some pieces that fell into place, and I was promoted to trauma director at my hospital, and shortly thereafter, chair of the Department of Surgery. And so that's my professional career. That's one hat I wear. I'm also the proud mother of three wonderful children, all of whom. Um, are great in their own rights and probably don't want me talking about them on a webinar, but that is my truer claim to fame because at the end of the day, medicine is a great career, but it's just a job. So that's me. I don't know what questions you have planned for me tonight, but feel free to ask whatever.
Okay. So, what inspired you to pursue medicine and how did your from upbringing shape your journey?
Sure. Yeah. So I am the child of a nurse, and my father has shaped his career around long-term care. So he owns and operates nursing homes all over the United States. So neither of them are physicians, but I grew up in a household where medicine and healthcare was very much like part of conversations at the dinner table or at the Shabbos table. I'd go to work with my parents and I kind of saw what they did. Neither of their career paths were something that particularly interested me specifically. And when I was in high school, I decided, or, at that point, I kind of thought I was interested in medicine and I thought I wanted to be a doctor. So, I had a lot of my parents' friends were physicians and I'd go shadow them and spend time with them at work. And I really, really, really loved it. Um, in college, I really was very convinced that I was going to become a nephrologist. Like I knew I was going to be a nephrologist. I did research between college and medical school in a lab in Bethesda, Maryland, where we looked at the medullary collecting duct of rats, and studied various hormones and aquaphorins. And I really, really loved nephrology. And I mean, that takes me back to one of my father's friends who is a nephrologist. He was the chair of nephrology at a hospital here in Colorado, but has since moved to Maryland. But I spent a lot of time with him, shadowing him, and he kind of introduced me to lots of people in academic medicine, and I thought that that's what I wanted to do. I say that because during my first year in medical school, another friend of my parents is a transplant surgeon also in Denver. And when I came back for the summer after my first year, before my second year, so before any of my clinical rotations, I asked him, can I just like watch you transplant a kidney? Because like I like kidneys, I think they're really interesting, and I'm going to be a nephrologist. And he said, well, why don't you come spend like a week with me or 2 weeks with me? You can kind of spend some time with me this summer and just see what I do. And I was like, yeah, I don't know if I really want to spend that much time in an operating room. Like it's just like gory and whatever. And like I was the person in my anatomy class who like was the note taker. I didn't want to touch any of the bodies because just the formaldehyde, and it was just like not my thing. So I took notes for everyone and really organized things that way we can all memorize everything for the exams, just to give you guys an idea. But I can tell you that like on day one of those 2 weeks that I spent with this surgeon, like there was an exact moment in time where it was like an epiphany or a transformative moment where I said, like, this is what I want to do with my life. I want to be a surgeon. Like you can take something from someone, find a problem, sew it up, replace it with something else, take out something that's dying, and like you can help bring this person back to life. And it was just so miraculous to me. And I just, at that moment in time, I knew that that's what I wanted to do with my life. Um, so yeah, so that's, I mean, that's like the long and short of how I got to wanting to be a surgeon. Wa Growing up in a frum household and wanting to do that, there were never any impediments for me because my parents were always very, very supportive of my professional journey and my aspirations. I have two sisters, one is a PA, one is an attorney. So my parents always encouraged us to pursue our dreams, and we all married B'nai Torah and have, thank God, wonderful families, despite the fact that we didn't go pursue careers as, teachers or occupational therapists or any of like the typical from careers, right? Or, and I'm not disparaging those at all. I could never be a teacher, just like I could never be a pediatrician. But I'm just saying you can do it. And my parents never discouraged me. And there were lots of people who did, but certainly not in our household.
And someone asked in the chat, what medical school did you go to?
Oh, sorry, I went to the Technion in Israel.
How was that experience going to medical school in a I guess in Israel, but it's still a foreign country away
Right.
from your family and everything?
Yeah. I mean, we had like cousins in Israel. Like none of our like me and my husband were both the oldest. So it's not like we had like older siblings who were like living in Israel or anything like that. We were those siblings for our siblings who were like coming to Israel for seminary and stuff. So it was definitely, a major culture shock in, the sense that like, you go to Israel and going there, for seminary or yeshiva is very different than going there on like a real student visa with a family, so like we had one child at the time, but the responsibilities and just kind of the life is a little bit different. And so that was definitely, interesting for us the first few months, but you sort of get used to it. And I think it was an amazingly transformative experience that truly shaped the rest of my career, and I wouldn't trade it for anything. When I was waitlisted at a couple medical schools in the States, including one in Chicago, and one in Colorado, like at that point that summer, me and my husband were kind of trying to figure out like what we were going to do because we're like, okay, it's kind of coming down to a wire. It's like if we're going to make this move and move to Israel, like, are we going to wait on the University of Colorado or are we going to wait on University of Illinois? Like, or because we lived in New York at the time, like we have to know what we're doing. And he was sort of like, I mean, he was very, very much on board where he said, no, like this is the best move for our family right now. And I agreed. And we spoke to our Rav, we spoke to our parents, and I there was no looking back. And it was an amazing 4 years that transformed our lives, transformed our children's lives, transformed our careers. So
So, can you tell me about how, when you had your kids and how did you navigate, being a mother and going through medical school and residency and
sure.
all all that?
I had one kid before medical school, one during medical school, and one during my surgical residency. And what I would say to anyone, there's a lot of names on this chat, most of which I don't recognize, but what I say to anyone who's at any point along that journey, whether you're single or married, whether you have one kid, two kids, three kids, 12 kids, it's all doable. It's like none of those things should be an impediment to moving on if this is the career path that you want. You just have to be organized and be able to plan things well. It's also really important to have a supportive spouse. I give so much credit to my amazing husband who's been my rock every step of the way. And having a supportive family, I mean, I can't tell you how many times during my residency training, I worked at the time, I trained at the hospital where my sister's a PA. And there were lots of times where like I was there on 24-hour shifts and she, was working from 7 to 7 or whatever. And I'd be like, oh my gosh, can you do this and this on the way home or whatever? Can you check on my kid? And she would, because I had siblings who lived in the same city. My parents live 6 blocks away, so like having that support system is indispensable. And if you're able to sort of make your medical school training or your postgraduate training work in a location where you have a support system, that's more important than anything else, more important than the prestige of the program that you choose or friends or anything else, because it's tough without that. But going back to like each kid, I would say that the hardest of like the most challenging maternity leave of my three, ironically, was in medical school. And that's not because anyone at Technion was not supportive, because they were, and it was an amazing place, and it was a great, great 4 years. But, and maybe a lot has changed because this is like 15 years ago or something, but when I was in medical school, like it was during my third year of training. And so each rotation is set in stone. Like you have like 6 weeks of internal medicine, and then you have 6 weeks of surgery, and then you do 6 weeks of like OB and 6 weeks of neurology. And so all of those have to add up to X number of weeks in a 52-week period in order to finish that year and progress on to your fourth year and take the next step of your USMLE and all of those things. And so, I knew I was having a baby during my third year, and they were very accommodating in terms of trying to like make the rotations match up with what wouldn't be as stressful. So, I actually was on my family medicine rotation and I was supposed to be on my pediatric rotation when I gave birth, but I ended up giving birth early, as is my usual. Um, but either way, both of the groups, like the family medicine attendings and the, pediatric attendings, were very supportive. That said, if I officially took off anything more than 2 weeks, I wouldn't be able to finish that year on time to start my fourth year of medical school, which would mean that I'd have to like delay starting internship and residency and all of that. So it was definitely hard. Like I went back really right after my son's bris. But, I mean, my mother came and she was there for 6 weeks. My husband was able to take off a little more time. And again, as I'm sorry to those of you who are on this Zoom call who are in medical school, but as hard as it might seem and as harrowing as it might be in terms of the hours, it's medical school. It's not residency. You don't have 24 or 48-hour days. And so like it was hard to leave my baby, but I came home at night. So they were very, very supportive though. But I think that's all it takes is just, advanced planning and organization and sort of the knowledge that like everything is temporary and this is only a few weeks or a few months and things do get better.
In residency, you got 6 weeks off, or did they? What happened
Um,
there?
I definitely got 6 weeks off. I guess I reserve the fifth because I don't want to get my former residency program director in trouble. He's an amazing, amazing guy. It was probably a little more than 6 weeks. I don't know if anyone here is listening from the American Board of Surgery, and I don't want anyone to like, take away my board certification or anything, but they were very, very flexible and supportive, I guess is what I'd say. So officially, yes, I had 6 weeks off. Unofficially, when I freaked out about 3 or 4 weeks into my maternity leave and called my program director crying, saying, I don't think I'm going to be ready. And I don't remember what it was, 2 weeks or 3 weeks. He just said, he's like, Chevy, if you call me the night before you're supposed to come back and you say like, I can't come back, your responsibility is to your family. My responsibility is finding coverage. Like it's going to be okay. And for the most part, I had very, very, very supportive co-residents. So yeah, I mean, it was yeah. And even when I came back, it was a soft landing in that I was able to come back onto a surgical rotation, which I mean, to most people listening would be like, "Oh my God, that sounds terrible." But I came back onto like a trauma and emergency surgery rotation, and I was doing trauma fellow like like that was my career trajectory. So to me, that was much more welcoming and comforting to come back to that rotation than to go back to something like surgical oncology or vascular surgery or whatever. And so, I was able to arrange it in such a way that it worked out all right. So, and then I think my pace off vacation, again, my vacations weren't taken away from me or anything, but like my pace off vacation sort of evolved into my maternity leave or vice versa. And so it worked out. So I would just say to anyone on this call, like I'm talking about a very, very rigorous academic surgical program that is a top 10 program, and they were that accommodating. So most programs, if not all programs in the US, I assume, because that was a lot of years ago, will be even more accommodating these days. It's really most specialties, especially the procedural specialties, have become much more family friendly, and want to encourage women to, join. And so don't think that having a family or wanting to have a family or planning how you're going to have a family is an impediment. It's just sort of part of your path.
And I'm not sure if everyone on the chat is aware of how a surgical residency is structured, how many hours a week. is it is. And also how I mean, it also has changed. They now put it like
Right.
an 80-hour limit a week, but,
Officially.
yeah, and how it's like the Q, if you could explain a little bit about like, Q24, or
Yeah.
that Q4 or whatever. I forgot the term, but yeah.
So I mean, ever since I think the late 90s or the early 2000s, there were laws passed which, mandated work weeks for surgical residents couldn't be, or work weeks for residents across the US couldn't be more than a certain number of hours per week. The adoption of such laws has been, more of a give or take between specialties. So, and the rules have gotten stricter, which, there's good and bad to that. And I say that because as the rules get stricter, programs realize, well, wait a second, we can't teach these people as much as we were able to teach their predecessors in X number of years. And that has resulted in extending the number of years of training, because you can't teach as much in the, same number of years. For example, in Israel, after stage, which is intern year, surgical residency is 6 years. So it's a total, I'm sorry, surgical residency is 5 years. So it's a total of 6 years as opposed to, in the US where it's still a total of 5 years. But, emergency medicine, for example, used to be, a 3-year residency across the board. Now, most emergency medicine residencies are going to 4 years for that reason, because they're realizing with these shifts, people can't do as many procedures in X number of hours, X number of days, weeks, years. And so they're having to extend that. That said, for the most part, the maximum number of hours that we officially worked per week was 80 hours a week at my program. For the most part, that was adhered to. We were encouraged to go home if you were over those hours, and you kind of got in trouble if you were straggling, if you're like, well, I want to stay more for different things because the program got in trouble. So to the extent that, at one point, I think the chair of surgery got a report of like, when people like when they clocked in and clocked out of not clocked in but whatever of the parking lot, like, because he was able to see that, and it was like, okay, if you were really there for over 110 hours, like the chair of the department would actually call you, be like, look, I mean, that's really nice that you want to do all these extra cases, but we're like, that's not helping you. We want to help you learn. What can we do to help you be able to learn everything you need to learn given the constraints that we have? So, I mean, I think residency training is a lot kinder than it used to be. So you have a lot of that. I mean, there used to be an old joke where it was like, how did they say it? Like, the only cases, you know, basically, like, you used to do 24-hour calls. So you'd be on call for 24 hours and then you'd be off for 24 hours and then you'd be expected to be back, the next day. So they'd say, the only cases that, you missed during residency were the ones that you kind of slacked and didn't see during those 24 hours you went home. It's really not like that anymore. It certainly is rigorous. I don't want to give anyone the impression that it's like some sort of 9 to 3 sort of situation, because it's not by any means. I missed lots of things over, those years. I missed lots of, Chumash parties and, little league games and drop-offs and pickups and all the rest. But it's a finite period of time, and I think that like any other profession, sometimes there's a little bit of a give or take.
I'm remembering my surgical rotation, and after, like, a long surgery, one of the surgical residents would literally shake, like, after the end, and I was just like, we would, like, ply him with apple juice and, like, sleeping
Yeah,
and be
it's
happy, be
that
nice.
sounds terrible. Our program was
It
not
is.
like that. I mean, yeah, there certainly were attendings who were not known to be the nicest and were very, very, very demanding. But I remember, like, with, I just mentioned, like, our chair of surgery, Dr. Schulich, like, we didn't really get to do operations with him until you were a chief resident. Like, you weren't able to, like, unless you were like the 5th year, like you were the final year, those were the people he invested in, because it was like, okay, like, you've made it to the end, and like, he wanted to hone in on your skills. And I remember doing a Whipple procedure with him, and this was like it was like 6 months into my last year. But, I was doing something and he was really just kind of watching. And he was like, Chevy, like, your hands are shaking. Your hands can't be shaking. Like, just look at me as a friend. I'm just here to help like hone in and give you some guidance and like teach you some skills. Like I'm not here to criticize you. Like you're at the end. Like don't shake. Like we're friends, you know? But he was so and he is scary. He's intimidating, but I mean, he was so kind and he's like just take a second, take a breath. Like it's just me. Like I'm just across the table. I'm here to help you learn how to be better and how to like, perfect your skills. Like this is not something where you should be scared. But I mean, I can count the number of times where I was like that terrified or where I walked away crying or anything like that. So,
That's great because I mean, as a medical student, it's like you do feel like some tension, like you feel the
yeah,
tension in the room sometimes, and it is a little bit like, oh my gosh, are they upset at me? Like, and then like the resident after would be like, why? Like you're okay. Like anything
right.
that you do, like we're not letting you do anything that you can't do, we can't fix. So
Yeah. And the other thing is, I think I remember that now that you say it, like I remember that feeling as a medical student because, I'd like cut a suture and this one would be like too long, too short. Like, and I was like, oh no, and you get so scared. But at the end of the day, you're right. Like no one's letting you do anything that's really that high stakes. Like it's nothing that can't be fixed. And the culture and the environment in an operating room is very different than any other like work environment. Because on the one hand, you come in there and they're like, "Hey, what's your favorite music?" Someone turns on some station or whatever, and everyone's just kind of like a little bit jovial and sometimes joking around as things get started. But then, if there's bleeding, if there's anything that is serious, it changes very, very rapidly, and it's a very austere place where, life and death are literally in people's hands right there. And so it's a strange, delicate balance, and you kind of get used to it after many years. But when you're, a medical student or you're a junior resident, it can be very daunting. So yeah, you're right. But don't don't let that scare you away if it's something you're interested in or that's where your passion lies, because not only does it get better, but that just becomes like your zone. So I mean, like, I don't know. I mean, I like to run, right? So the first time you try to like not even run a marathon, but the first time you try to train to run a marathon, it's like, oh my gosh, you run 2 miles and then you try to get your times better and stuff, and you're like, wow, this is torture. But then eventually you kind of get into your groove and you're like, wow, this is really nice. Like you listen to your music or your podcast or whatever it is you do while you're running, and you're like, wow, like this is my zone. Like I'm not even realizing how far I'm running because this is enjoyable for me to do. And it just kind of it becomes more of an autopilot thing where you enjoy it. And so it's sort of like that. But at first it is daunting, to like take on a new thing. So
okay, and talking about balance in of you know in surgery, how did you balance being religious and like things like Shabbos and Yantif? Like, what did you do during those times? How did you deal with it? And
yeah. There were a lot of challenges along the way. I'll start with that. So medical school, I was very spoiled because I went to medical school in Israel, so it was really never never really much of an issue. Sub-Is and whatnot, I sort of said, hey, look, I'll work I mean, and it's not working, you're a medical student, but like I'll come in every Sunday if I don't have to come in Saturdays. And, I did 3 Sub-Is, or whatever you call them, like elective audition rotations at different hospitals, one in LA, one in New York, one in Colorado. And I mean, I was a medical student. No one gave me a hard time about that. I never even brought up, oh, it's because of my religious beliefs. I just said, hey, I'll do Sunday through Friday. And I guess I was just fortunate. Um, Internship and residency were definitely a challenge. You're sort of expected, for the most part, it's like black weekends and golden weekends. So you work a Saturday and Sunday one weekend, and the next weekend you're off Saturday and Sunday. And it was like that for a lot of years. And I give my husband a lot of credit for holding down the fort. There were a lot of early Shabboses. There were a lot of him spending Shabbos with his in-laws, which, I'm sure every person on the Zoom call definitely, understands is not always as enjoyable. And, I mean, I think he gets along well with my parents, always has, but like, it's not always what you want to be doing. But there was a lot of him holding down the fort. All of my vacation days were exhausted and meticulously calculated around Yuntif. So Rosh Hashanah Yom Kippur Sukkot was really, really hard every year because like you can't take off. I mean, I guess you can, but it's really challenging to take off 3 weeks in a row like that. And even if you take off 3 weeks, like it doesn't take care of all those days. So that was very hard to split. So I'd have to maximize those. And then you have, I mean, Pesach on the other side of it. And then, on top of that, like then what about Shavuos? And it's like, well, we've never even heard of this one. So it was definitely a challenge. I guess, in terms of the halachic aspects of it, which I won't, really delve into, but, everyone just kind of has to ask their own competent local Rav. We ran everything by a posek, and, I'm very thankful that I have a husband who's learned enough to be able to know which things he was able to help me with on his own versus which things he said, okay, we have to ask about this. So it's always important to know when to ask, so there's that. Things got better during the more senior years of training where you have a little bit more say, where you're in charge of making your call schedule, where, as a chief resident, you're assigning those shifts to the junior residents and you're able to say, yeah, I'm going to do all the Sundays. Sorry, that's just how it goes. So there was a little bit more of that. And so you're able to sort of like make those asks or make those trades. There were definitely monetary trades that I did. I mean, there were times I paid people a lot of money to like trade because, one time it was I couldn't figure out a way to make Rosh Hashanah, Yom Kippur, and Sukkot work. And so I paid someone more money than I made in a week to not have to work one of the days of Sukkot. Now, I don't know if that's halachically required, but I couldn't bring myself to go to the hospital on those days. And thankfully I was able to make it work. Another thing, just psychologically for me, and this is just me, and I've said this before on other podcasts if anyone's listened to them. Whenever I went to the hospital on Shabbos or Yontif over the course of my training, I never said to my kids or anyone else that I'm going to work. Like, it's not work. Like, you don't work on Saturdays. That's not a thing. Like, I was going to the hospital because I had to take care of people that were sick, and I had to make sure that if I could save someone's life, I was going to do that. And I was very, very deliberate in my word choices, and it made it I think for me, it just made me feel like I don't know. It just made me feel like I'm deciding to do what I need to do because this is Hatzalas Nefashos and like this isn't because like it's a job. So that made it easier for me. I think from a chinuch perspective for my children, it was, hopefully it was helpful. I've never really asked them, did they kind of, infer the difference? So I don't know. But yeah, those were things that helped me get through it. But just having an amazing support system, an amazing husband, awesome kids, and siblings, parents, in-laws, etc., who were there every step of the way.
Okay. How did you deal with the pushback? This is from one of the people in the chats. How did you deal with the pushback and discouragement from others, especially within the Jewish community?
Hold on, I'm just plugging in my computer. Sorry, I'm out.
Oh,
Um, sorry, because it's telling me that it's like low battery, and I think it's not unplugged. Sorry, sorry. Okay, sorry. Hi, I'm back. How did I deal with pushback in the community and whatnot? Yeah, so I mean, at different stages in my life, there were different levels of pushback. So like, starting from when I was a teenager and I was in high school, and there were like various, teachers and whatnot in, who would be like, don't you want to just be a nurse like your mother? No, and it's not just. My mother had a completely different career than me and a completely different career trajectory and was able to do things that I could never do, like spend lots and lots of time talking to each patient that I could not do. Lots of bedside care that I'm not capable of. So no, I didn't want to be a nurse like my mother and but there was that and there were people who said things like you're never going to get married, you're never going to find the right kind of guy. But I mean, I think I just had very encouraging parents, very encouraging family members. I mean, specifically, I think of a couple of my aunts who, when I was in college in New York, were like, "You're gonna find the right one. Like, there will be the right person. You just, like whether or not you're going to medical school or whatever school, like this is what you want to do, and like you just need to be honest about it." And so, that's how I dealt with it. But I don't want to say it was always easy because like there were lots of people along the way, like with shidduchim, who said no, and I was like, well, there will be the right one. And thank God there was. And then, later on, also, I guess the same thing when, I went to medical school and said, I'm going to be a nephrologist. And that kind of, I mean, doing an internal medicine residency, lots of people do that. It's just sort of, more typical. And so, like, cool. And then suddenly, when I kind of started telling people, oh, actually, you know what, I decided I want to do surgery instead, there were lots of people, and not just sort of from like the more yeshivish Beis Yaakov crowd, but lots of people kind of who are even more modern who are like, well, so you're going to do that, and also you're going to be a mother. I was like, well, I already am a mother. I mean, yeah. But I dealt with it because I knew that this is what I wanted to do, and I kind of had always been told by my parents that, like, you want to achieve something if you work hard, and you have, the emuna and the, that Hashem is going to give you those skills and you work for it, you can do it. So, but yeah, I mean, that's how I dealt with it. And I mean, sometimes, when people would say things that annoyed me, sometimes I just rolled my eyes. I'm trying to think. There was like a quote I saw recently, but it was like, if you wouldn't take I'm trying to remember how it went. Like, gosh, like if you wouldn't take bad advice from someone, why would you take good advice from them? Like if you don't want to listen to what they have to say, like in a bad way, when they like badmouth you, why would you listen to what they have to say when they tell you, oh, you can't do it? I can't remember the exact quote. I'm not eloquent enough to like quote it, but lots of people, there's going to be lots of naysayers. There's lots of, things that people are going to say. If this is what you feel like you can do and you're succeeding at it, just keep going and stay in your lane. And that's it. And there's no one else to compare yourself to other than yourself.
That's so true. There's always people that just like to put others people's down, and you don't know what their thoughts are. And I don't know, a doctor that I met for 5 minutes was like, "Oh, you're gonna make a great doctor, Esther." And like, I was like, and another student was like, "How do
Right.
you know?" And I was
Right.
like, because, but I'm like, I was just people say things like just to be nice sometimes, and
Right.
either way, it doesn't matter what other
Right.
people say. It's just what's in your heart that matters.
Exactly. And so the same number of people like that say to you things like that, like, oh, you're going to be a great doctor and just met you 2 minutes ago. So if you don't take that so seriously because you're like, hey, you haven't trained me, you know nothing about me, why is it that if you walk by and someone's like, oh, Esther, yeah, like you probably should choose something else. This is not for you. Why do you let that affect you? But I mean, that was literally that quote, and I just can't think of the words. But yeah, like that's exactly it, where it's like, you're going to have naysayers, and if if you feel like this was the choice for you, then just go with it. So it's just a job, and I'm not trying to denigrate anyone's job or put down what anyone does, but people kind of put different things on a pedestal, and it's like, really, at the end of the day, if kind of I simplify what I do every day, I'm nothing more than a glorified plumber or seamstress. Like, you find places where there's obstructions and you unobstruct them. You find places where there are holes and you sew them up. The technical aspects of it are very, very teachable. You could teach a monkey how to operate. It's sort of the thought process that goes into that, and then the interpersonal things that happen on a daily basis. Those are the more challenging aspects of the job, but it is just a job. So it's a fun one. I love it. But
After how many years of training are you able to say that it's just a job?
yeah, yeah, true. But there's a light at the end of the tunnel, is what I'm trying to say. And I'm not that old. So I'm still in my 30s.
No, the 5 years of residency, it's a little daunting, but as you said, if that's what you want to do, it's something worth it, and it ends at a certain time. Um,
Wait, hold
Another
on.
question.
Wait,
Okay,
pause for 1 second.
no problem.
Can I pop in and say something? How many people are on there?
I don't know. What do you want to say?
It's not big.
My husband wants to say something.
The one negative is that after working so hard for so many years, to become a doctor, you get packages in the mail that says Mrs. instead of doctor, but it's just collateral damage. But everyone should have good luck in whatever they're trying to do.
That said, that does bring up an interesting topic. Hold on, I'm just closing the door because this is almost dinner time. My husband says that because thank God he's very proud of what I do. And so he'll correct people. But, for example, in our children's, like, our school directories and stuff for the yeshivas and stuff, it says Mr. and Mrs. Daniel Kassai. And like that is deliberately how I want it. Like the same sort of thing that I said when I was, in training, where I said, hey, like, during the week I go to work, but if I have to go to the hospital on Shabbos, I'm going to save someone's life. It's not like I'm going to work. Same thing with Mrs. Like at the hospital, I'm a surgeon. At the hospital, I wear lots of hats. I'm the chair of a department and, I'm a trauma surgeon and I save lives and I do all of that. But both based on my, I don't want to say my halachic beliefs, but based on, the psak halacha of me or our family, like I don't wear scrubs outside of the hospital. Like I change my clothes and I go home. So A, there's like a halachic or hashkafic aspect to that, but B, there's like a psychological aspect to that where like when I leave the hospital, I'm not Dr. Kassai. Like I go home and I'm a mom. So like you kind of keep the things very separate and it makes it a lot easier to go home and sometimes most of the time turn off my phone and be a mom, but every once in a while there's some hospital administrator who still does call me at 6:05 p.m. So
And another question we have from the audience is, would you recommend considering pushing off medical school until after children get a bit older so you do not miss out on crucial early years of your children's childhood?
no, because all the years are crucial. And like if you think about it, when a child is very young, if they're, a baby, an infant, like they don't need a mother. They don't need a mother's advice. They don't need your time necessarily. They need someone to put a bottle in their mouth. They need someone to change their diaper. And I'm not diminishing the importance of those years. I'm sad that I missed things during some of those years or some of those months, but there's never any period that's not any more important. I mean, now that I have, boys who are older, I have like a 16-year-old and a 12-year-old. Like they might not need me to give them diapers or to give them bottles and change their diapers, but it may not be 24/7 care that they need, but the time commitments and the like intellectual commitments and the conversations and the advice that they need, it becomes even more important as they get older. So I don't think that there's like a right or wrong way to do it, but don't delay things because, oh, it's going to be easier in a year or 2 years or 5 years because, they say like little kids, little problems, big kids, big problems. It just gets more complex as they get older. So.
I have a lot of co-medical students, I guess, also who have like two kids, one kid, and they all say how difficult it is, but they're all doing it somehow. I don't know how. I kind of admire them from afar, and I'm just like, wow, you guys are like so cool.
Can you time out 1 second? I'm so sorry.
No problem.
Sorry. Sorry, guys. This is like I said, this is witching hour, so um but yeah, exactly. I mean, it's hard no matter what you do. And so you hear people say that, who are in medical school have one kid, two kids, three kids. I mean, there is a neurosurgeon who was at my last hospital who she had 7 children. She had 4 of them during her neurosurgical training, I mean, there's no right or wrong way to do it. And it's more about who you are inside as a person and what you're able to handle. And that's not a question anyone else can answer besides you and, God and your spouse. But there's no right number, there's no right time. And it's like being in medical school or in residency or being an attending and having kids, it's that has nothing to do with it. Like you could be a manicurist or, a physician's assistant or I mean I'm just a flight attendant, whatever it is, whatever your job is, it can be challenging just depending on how you kind of structure things like that. I know, even daily, I know, sweetheart. Okay, Lily, let me finish my Zoom. Okay, beautiful. Sorry.
Well, speaking of your child, how do your kids feel about you being a surgeon?
Um, it's so funny. Like my oldest, he finally decided one day, he was off from yeshiva and he was like, can I come hang out with you? I want to see like what I mean, they've hung out with me in my office before and kind of sat around and like played on my phone, but he was like, I want to see the surgeries that you do. And he did, and he asked a lot of very intelligent questions and kind of stood in the background. He didn't faint, he's not, scared of blood or anything like that. But I was like, so do you want to be a doctor now or a surgeon? He's like, oh no, absolutely not. I still like want to be a lawyer. Like it was not, but he's like, but it was so neat to see what you do. It was like fascinating for me to see. Like I thought there would be more blood everywhere, like just like on TV. And I was like, yeah, it's not like what you see, on ER or whatever. And then my other kids, yeah, I mean, they're, they come to work with me, they hang out, they've gone on rounds with me, they've seen patients with me. I mean, just today, I know that this is called, what is it? Scalpels and Siddur parties, we named it. Just today, I went to my kindergartner's class and we did a little talk on shots and why shots are not scary. And, we talked about stitches and why if you have had stitches, they're not scary. And we showed how we sew things if someone needs surgery, and we did surgery on bananas. So yeah, I mean, like they know what I do. They think it's, cool for the most part, I think. It's a job. Like, it's not a nerdy job. So I think my kids think it's kind of cool.
Good. Um, so another person in the audience asked, how do you deal with the pain of patients or a death of patients and not having it affect your home?
Um, I think you get better with it with time. It's a tough balance because you don't want to become so hardened where you're just like, yeah, just another one bites the dust. But to a certain extent, you have to sort of develop a tough exterior and interior, like a real thick skin, so that you realize you separate what you do at work and some of the gruesomeness of your job from home. And I'd say for the most part, I think that like, most of us in medicine develop various coping mechanisms. I'm in a more intense specialty where we see things that are particularly, you know, I don't know a better word than gruesome or heinous sometimes, where we see people who are, shot in the heart or, I'm looking at a picture on my computer right now, or I just someone sent it to me. But it's a woman who this was a neurosurgeon and he sent this to me a few days ago, but it was a woman who is who was a nurse, and she was driving home, and I guess she fell asleep at the wheel, and there was a piece of plywood that got impaled on her I mean, it went through her entire face. I mean, she died, but I don't know why he sent this to me, but I'm just staring at it right now and I'm like, I mean, if anyone else saw that, they would like just be so nauseated seeing it. And I'm just like, okay, I just thought of that right now because it's sitting there. But I guess you sort of develop a thick skin to these things because that's the only way you can go home and just, uh, you know, cope. It's the only way that you can survive. So, I mean, humor, sarcasm, psychologists, emuna. I would say that, if I had to choose one, it would probably be that. I mean, there's not a single operation that I've ever done, since I was a resident where I don't say a little tefillah before, like while I'm washing my hands. And it's very clear in my mind, doing any surgery that like I am just a messenger, and some patients you sort of expect are totally going to do okay and they're going to live, and they don't. And there are some patients where you're like, yeah, I don't even know why I'm doing this. They're so far gone and they end up sort of surprising you and they end up doing all right. And so it's really not, you realize very, very quickly in your first few years that like you're not calling the shots. Like I said before, I'm just a glorified combination of a seamstress and plumber where, you sew up holes, you take obstructions, things that are blocked, and you unblock them. And, the rest is sort of, in Hashem's hands. And not sort of, it really, really is. And I think for me, at least, that's my biggest coping mechanism is to fall back on that and to fall back on like my faith and realizing that this is a job. I go to work, I do my hishtadlus, I do whatever I'm able to do, and I give 100%. And the rest is beyond me. That's not to say that sometimes it really doesn't hurt. It's not to say that sometimes it doesn't make you kind of look back and say, what could I have done better from a technical standpoint? I mean, we have M&M every week. I have to run that. And so I have to sort of critically ask myself in front of others when I have to present cases and say, hey, so I screwed up this time. Like, this is me presenting a case to everyone else and saying, hey, here are things I could have done better. And so, that's even harder than when someone else is asking you because I have to like openly admit it without someone kind of asking, calling me out on it. Um, but I think that those are some mechanisms you learn over the years. And I think in every specialty, there's specialty specific mechanisms you develop, and I think every person kind of cultivates their own. But those are mine.
Okay, so I'm gonna ask two other questions from the chat, and then we'll open up to all the other participants as well. What are the unique challenges of being a surgeon mom as opposed to physician moms in other specialties? And what are your hours like now? And how does it work with your family life?
Cool. Yeah. So, okay, those three separate questions. So, specific challenges to being a surgeon mom as opposed to other specialties. I would honestly say that when I was a surgical resident mom, there were unique challenges, because that brought with it a very, very labor-intensive schedule. Now that I'm an attending and sort of am able to, not sort of, but I'm able to sort of, I keep saying sort of, but now that I'm, thank God, able to control my schedule, the challenges are just like anyone else who has a job where they're not, a stay-at-home mom or have a job where they're working from home. So I can't think of any specific unique challenges, other than sometimes my kids will call and I'm in the middle of surgery. So they'll call two times, they'll call a third time, they'll FaceTime. And so then I just ask the circulator, like, okay, can you just pick up the phone? So I mean that's a challenge sometimes. And sometimes I'll be like, Mommy, like, what are you doing? I'm like, I'm in the middle of surgery. So and everyone kind of laughs. And I mean, they're especially, these days, I mean, usually, your circulator or your scrub tech, those are women too. And sometimes you'll have a female anesthesiologist and everyone kind of thinks it's cute. So, or sometimes my youngest daughter will call me if I'm like in the OR late at night because, we do 24-hour calls and she'll be like, Mommy, I just want to say Shema with you. So, I'll be like, okay, so guys, you just have to take a time out. I'm just going to kind of go, say goodnight to my daughter and sing her some goodnight songs. So, I mean, those are unique challenges, I'd say, because like, I guess you don't have that if you're, in, pediatrics or, radiology where maybe you could step away physically for a minute. Like I can't even touch my phone. But short of that, like it's just a job. And so then moving on to the other questions of what were they? Just like hours and how that works. Repeat the question. Sorry.
Sorry, it's what are your hours like now, and how does that work with your family now?
Yeah. So my hours are very regimented and structured given my specialty. So I'm a trauma surgeon. And so the way that it works in like trauma and acute care surgery, not just at my hospital, but at most hospitals around the world, is that it's very much shift work. So the same as when you're a resident and you're on call for a certain number of hours, whether that's 12 or 24 or whatever, it's the same thing on the attending level where we do 24-hour shifts, but at some hospitals they do 12-hour shifts. So, I am the person who is on call from 7 a.m. until 7 a.m. And so, anything that comes my way between 7 o'clock and 7 o'clock the next morning is my problem. At 7:01, I hand that all over to one of my partners and I change back into regular clothes. I walk out of the hospital and I'm no longer like Dr. Kassai, chair of surgery. I go home and I'm mommy and I take my kids to school. So, it's very, very regimented. There are multiple additional responsibilities that I have sort of running a department, and there are administrative requirements and responsibilities. And right now we're in a trauma review year as a trauma center, and that takes extra hours. But those are all things that can be planned. Those are all lots of Zooms. Those are all lots of in-person meetings, but those are very, very much 9 to 5. So my schedule for the most part is that, I work most Sundays. So I do 24-hour shifts on Sundays. And then the same thing for, some of the weekdays, usually Tuesdays and Thursdays. So when you add up all those 24-hour shifts, that is much more than an average American's 40-hour work week. But, compared to what other doctors work, it's kind of, about average. I, for the most part, don't work Fridays. Sometimes I'll have some meetings on Friday morning, but I, don't ever do shifts on Fridays and I don't work Saturdays. So, because our shifts are 24 hours. So a Friday shift would be 7 a.m. Friday until 7 a.m. Saturday. Same thing for Saturday shifts. So that's why I do a lot of Sundays. And, I was very, very scared of sort of making those asks when I first joined this group, 6 years ago. But my partners have been incredibly supportive and they're all parents. And so, they understood that, like, sure, these are my religious needs and requirements and asks, but I want family time just as much as they want family time. Someone else doesn't want to work any Tuesdays because he never wants to miss any of his son's football games. Like, that is like sacrosanct to him. Everyone has their things and we all work around each other's schedules. And some people want to work more, some people want to work less, because at this point, when you're done with residency, if you work more, you make more money. If you work less, you make less money. So some people are motivated to work more shifts because they take home more money. Some people say, hey, I can't work those shifts because of religious reasons, because of medical reasons reasons, because of, financial reasons, family reasons, whatever it is, but there's enough work to go around and there's enough people to, kind of cover all of that. So does that answer it? I mean, that's very general. I'm not telling you hours, but I do 24-hour shifts and then, Fridays maybe a few hours in the morning, and then Mondays are like administrative days too. So meetings, but and sometimes I'll see patients in the office on Wednesdays. But I try to pick up my kids from school on Wednesdays and Fridays.
And another question from the audience. As a trauma surgeon, do you only operate on one area of the body in particular, or can you operate on a majority of locations?
Pretty much majority of locations. So the exceptions being the brain. So anything above the neck, we call the neurosurgeons. And then extremities. So if someone comes in extremis, right, like their leg is half chopped off because they were involved in some sort of, a car ran over their leg, I can and will amputate their leg, right? But if they have like broken bones, like they have a femur fracture or tib fib fractures, for fractures of extremities, we call the orthopedic surgeons. So basically everything from the neck until the pelvis is fair game. So it's a lot. It keeps you on your toes because you never know what's going to come in next. But like I keep saying, and this is like a theme, is that, it's really just about kind of finding where something is blocked or obstructed, or finding where there's a hole and figuring out how to unblock it or how to sew it up. And it sounds really, really stupid or really, really simple, but that's all it is. And, a very thorough knowledge of anatomy and what will go wrong if you sew the wrong thing up, and what to connect to what if you need to kind of, take a detour. But it's straightforward once you learn the anatomy down cold, and you know that, all that by heart in your sleep, and close your eyes and kind of see all of that. And that takes a lot of years.
And so I take it you get to crack some chests open?
Mm-hmm. Yeah. Yeah. I did that twice last week. Unfortunately, only one of them made it, but yes. So multiple times, unfortunately, we get a lot of penetrating trauma at our trauma center. So.
Okay.
And again, I don't know, there's a new TV show that I watched a few episodes of because someone told me that someone told me, oh, it's really good and this is the most realistic one. This is more realistic than ER. It's called The Pit. So I watched a few episodes of that on my phone, and I will tell you that in either episode 2 or episode 3 they did a thoracotomy that was very unrealistic. So there was not a lot of blood, and there's not a lot of blood if they're dead, but that guy was very much alive, had a beating heart. And yeah, if someone kind of has a nail gun through their heart, we will deal with it, but not in the way it was dealt with on that show. So, but yes, I do that.
I watched it, and the that kind of the environment is very much the ER.
Right. No, it definitely is the busyness and the speed. So, but yeah, the austereness of the people who are sort of standing there while someone just kind of cut into someone's chest. It would be really nice if that's how it happened in the ER when we did ED thoracotomies, but it's not. In the operating room, there is sort of that very organized, methodical progression of steps, and it is more austere like that. Even when it's something like a thoracotomy that we're doing under a more planned circumstance, like in real life, that guy who, had a nail gun to his heart, and, I mean, anyone can watch this. I think it's like, it's like on Amazon Prime Video, but that guy with the nail gun through his ventricle, we wouldn't have done that in the ER. Like that needs to go to an operating room, and it would have been very controlled. This is a fixable problem. So yeah, that's why it's not good to watch medical shows. I mean, I think House was a TV show and I was in medical school, and like I just be like, no, this is not like, no rabies, no, like what are we talking, like what, hold on, Naglaria, like what? So same sort of thing. You don't want to watch these things with me because I'll critique it too much.
It was very difficult to see like blatant errors, like why is the in Grey's Anatomy they're all doing like they're doing neurosurgery and then orthosurgery and then general surgery, and I'm very confused. I'm like, what resident is doing all
Right.
surgeries? I
Really
just
a jack of all trades.
can't get over that. Like it's
Yeah.
just like basic, and there's no medical students either,
Right,
like,
exactly.
but I think that makes people understanding how like why there's there's a doctor and then there's a resident and then there's like three other people behind them, and those are usually medical students. And I
Exactly.
feel like people get very confused when it's a huge group of people because we're not
Yeah,
represented in Grey's Anatomy.
exactly. But I mean, there are some things on that show that I think do sort of depict reality, relatively well. Like when I don't remember what his name is, but the guy who was like Dr. Carter in the original ER show, when there's like a guy who dies unexpectedly of a heart attack in one of those first two episodes, and there's a medical student who's doing chest compressions for like a really, really, really long time. And he's devastated that like he lost his first patient, and he says, "Okay, let's just take a pause and sort of just think about this life that was just lost." I mean, going back to what I said before in terms of coping mechanisms for me, that does help me after, each, case if we do lose someone, because it happens very often I mean, I don't want to say very often, but it happens, relatively more frequently in, high acuity specialties like trauma surgery. And I do like to do that and kind of take a pause and sort of say, like, everyone just like, this is a human. We just lost a human life, and take a second to think about that and what that means to you and whatever, just take that moment. And to me, that's a chance for me to kind of close my eyes and thank Hashem for giving me this opportunity. And for whatever reason, this was the conduit I was supposed to be at this moment. And this is how their life was supposed to end. And, I appreciate the chance to be part of that journey. And hopefully I made that journey a little less painful for that person and their soul.
And do you have any tips for surviving a 24-hour shift, and how do you stand on your feet for so long? I
Take
think that's
frequent breaks, drink a lot. I mean, caffeine. I'm not a big caffeine drinker because like if I drink too much caffeine, I get really jittery. Like I actually really do develop a tremor, and that's not good in my specialty. But like if caffeine doesn't make you physically jittery, then drink coffee. Um, and like I mean the primary, the three cardinal rules of surgery are eat when you can, sleep when you can, and then don't mess with the pancreas. Like that's what they teach us. But really truly the eat when you can and sleep when you can thing is it's very true. Like take frequent naps. Like I will take naps even now as like an adult and mom of kids, like when I'm on call, like, if I'm not busy and we have an hour between cases or like there's no new consults and I have nothing else to do, like I will go lay down. Like I really, really will, as silly as that sounds, because it's like you just don't know what the night is going to bring. So take those opportunities. Don't go run around and do something else. But take those opportunities even between cases or between whatever you're doing if you're in medical school. That way, when you go home, you have more time to spend with your kids and you're not, exhausted when you get home if you can. So, and just know there's a light at the end of the tunnel. Like there's a light at the end of each day. There's a light at the end of each rotation, at the end of each month, at the end of each, either year of medical school or a year of residency or year of fellowship. Like it does eventually get better in terms of being able to be more in control of your life. And I remember like when I was a very junior resident, our chair of surgery said that. And I was like, because he was like, yeah, like and I didn't get it then, but he's like, your hours just don't get better. You actually work more hours as an attending than as a resident, because as a resident, your hours are protected. Like if you're at the hospital for more than 40, 80 hours a week, you get in trouble. There's no one protecting me. Like if I stay at the hospital for 72 hours, like no one's gonna be like, you need to go home or else. So if there's stuff that needs to get done, like it needs to get done. But on the other hand, you have control over when you work and when you don't work. You have control over your vacations. You have control over Shabbos and Yontif. You have control over like, tomorrow's my daughter's birthday, so I am not on call. And normally I do work Tuesdays, but I planned that, last month and I said I'm not taking call that day. Someone else is gonna have to take the 25th because I won't be there. So, you're able to sort of meld things as you want them to be melded a little bit better.
And how do you deal with like any exhaustion, like because it's very hard to work 24 hours, um being on call, and then how do you deal with that, your energy level, besides for taking frequent naps as well?
Um,
I feel like it's a similar question.
yeah. I think it is a similar question. Yeah, taking frequent naps, sleeping when you can. And also I think it's just like a matter of prioritizing. And this might sound really terrible or really selfish or like I'm a really antisocial person, but I can tell you that like outside of like my immediate family and like some very, very close friends, like I'm not like I don't go out to lunch all the time with friends and I'm not like going shopping with friends. Like I mean I don't have time for things that it's like if it's not work related or family related, like you eliminate things that are extraneous because you have to prioritize. And so you realize what other things are important and you learn how to say no. So, community commitments and different chesed things. Yeah, like you start to learn that time is money. So, every person who has a baby and I get like some WhatsApp, chat about like, oh, can you make dinner on this and this night? Can you sign up for this? I'm like, you know what? I'm going to send a gift certificate from a pizza store. And you know what? Here's dinner for you and your 5 children and plus, your husband and your new baby. Here's 3 pizza pies. I don't have time to go like make someone dinner like on a random Tuesday night, and to plan that. You want Shabbos, I will have it delivered. Like we can do that. You have whatever you have in your city. I mean, most people live somewhere where you can sort of arrange that. So you sort of are able to, really eliminate extraneous things. Shalach manos, there's another example. I mean, Purim's coming up this year, so it happens to be I'm on a Veilus this year, so I really have no chiyuv to give shalach manos, but for the most part, every year people talk about their themes and their kids' costumes and all these sorts of things. My kids pick costumes, whatever they want to do on Amazon, sounds great. And then we don't have themes. I buy shalach manos from Karen Aniyim. I'm supporting a, very, very wonderful cause and I'm giving tzedakah at the same time. And whatever we give out, we give out. I'm not doing little yellow and pink themes and not all my kids get to choose it. This year it's going to be Dalmatians and we're all going to be matching. I have never done that. I don't have time for that sort of stuff. If you want to make time for it, that's great. But like so there's those sorts of things too. 3-day yontif and cooking on yontif. Like I don't know why people have this like idea where everything has to be ready for the third day, 7 days before. Like not everything has to be that perfect. 99% is going to be just fine for a Luxon kugel, even if it doesn't look totally perfect. It's gonna taste just as fine. So you sort of like kind of realize those things over the years and just don't sweat the small stuff. Same with my kids. And I mean, I'll get texts a lot of times, I would say, from my daughter's one of my daughter's teachers because she does her homework but she forgets to turn it in sometimes. So like on Sundays I'm at the hospital usually, so Monday morning I know I'll get a text from Orachavi, she forgot to give in her homework. You know what, she did her homework. I know we did Kriya Friday night, she forgot to turn it in. It's gonna be fine. I don't like freak out because my little kindergartner didn't turn her homework and her grade might be lowered because she's not perfectly satisfactory. You just learn like what things to prioritize and what things are just gonna be okay. And I think that like helps with physical exhaustion and mental exhaustion. I don't make challah anymore. I went through a sourdough phase, probably like the rest of like the Jewish world. That was before COVID. We used to have like a starter in our kitchen. It stopped in 2020. Like sometime when COVID happened, we were done with that. I'm like, I have time for this. You can buy this. Like, why on earth would I waste like 4 hours of every week babysitting this stuff? You can buy this. Stuff like that. It's just sometimes you say it's not worth it, and you have to decide what's worth it to you. And everyone has different priorities.
Do you have any tips for like matching into surgical residency for anyone who is interested in who's in medical school or pre-med who wants to pursue surgery?
Yeah, honors on all of your third year rotations. Even psychiatry and pediatrics, you might think like, oh, this has nothing to do with what I want to do, but we look. Like when I was on an admissions committee for surgical residency, I mean, that was 4 or 5 years ago, but yeah, I mean, you need honors on all of those third year rotations, all your clerkships. Do really well on your self exams, and fortunately or unfortunately, research really is important to lots of programs. As to why, I mean, because people, why does it like I don't know why it matters. I'm just telling you it does. I'm telling you that you kind of get weeded out if, you didn't do, any sort of either clinical or basic science research. They look to see if your name is on any publications. So it's a box to check. And then I mean, it goes unsaid, because I've gotten these phone calls and it's hard to kind of steer people in the other direction. The numbers are different than what they were when I took the USMLE exams. And I know that now step one is no longer even, you don't even get a grade anymore. Like it's just pass or fail. So I guess that means step two is even more high yield. But like in general, I think when I was applying for residency, like if you didn't have above, I think it was like a 245 or a 248 on step two, don't even bother. I think it was 235 and 248 or something like that for step one and step two. So, when I get phone calls from people or, text messages or emails from people who went to my medical school or my college or whatever asking, what should I do? I really want to do surgery, but, I got a 227. I don't know what to tell you. You can take a year off. You can try to do more research. You can try going and training in another country and then repeating your residency. You can try doing a prelim year. But that's sometimes like, you're going to be up against a lot. So that's what I tell people is really, really, really focus on studying for those step exams because they make or break everything as stupid as it might seem. And as frustrating as it is, because like I remember studying for like hours, things like sickle cell anemia and the Krebs cycle and lots of things that like I don't remember anymore. But unfortunately, it makes a huge difference. Those are
I
my
think
primary tips. Yeah, get good letters of recommendation. Try to do away rotations, or like sub-Is audition rotations at programs that you're particularly interested in. And apply very broadly. I applied to 80 residency programs.
a girl I did a surgical my surgery rotation with, she was a fourth year and she applied to 200. I go to a two I yeah, I go to a DO school though, and she also was from a DO. And so it's when you go to a DO school, you have to apply to a little
More
bit
broadly.
broadly. But she got like, I don't know, 30 interviews. And
Wow.
yeah. And
Yeah,
she
see, I got
pencil
10 interviews from 80 applications. I mean, it's the yield is not great, you know? I mean, and again, I went to a medical school in another country, so I'm sure that limited some of it. And I got asked questions like, do you speak Israeli? Like, I mean, it was like they had no like so is your school like Ross University in the Caribbean? I'm like, no, it's not. Like, I mean, there was a lot of that and there was a lot of that to overcome, but I feel like, your residency interviews are as much like you sort of interviewing the program and seeing if this is a match for you as them seeing if you're a match for them. So there were programs that I interviewed at that I did not rank. Like one in particular that was in Ohio, and Cleveland was like, it would have been a nice city for us, and we're like, okay, like this community would be great, and we just there was the program director was a woman. It was a smaller community program, and there were 2 residents per year. So there were 10 residents total. All of them were men. So I was interviewing, and I was one of only 2 women interviewing that day. And she asked me, like, what do you feel like is your greatest accomplishment outside of like medicine? And I'm like, well, I haven't accomplished much in medicine. Like, I'm a fourth year medical student, but like, okay. And I said, I think, like the fact that I had a baby during my 3rd year of medical school, like not that I had a baby because like half of the universe, since the beginning of time has had babies, but the fact that I was able to balance everything and I was in a foreign country and like I was able to come back 9 days later and like whatever. And she just kind of like stared at me blankly and she's like, well, is there anything else? And I was like, well, yeah, I mean, I have, some first author publications from my time at the NIH. She's like, oh, great, tell me more about that. And I'm like, like, and I did, but I was like, this program is not for me. Like, I would not feel comfortable at this program because clearly their values are not where my values are, and they sort of are like not going to be supportive of me as a mother. And there were other programs that, because I applied, like I said, really broadly, and I wish I could have applied to 200 programs, but I also had a husband and 2 kids, and my husband we could only apply to programs where number one, there were, career options for my husband in those cities. But more importantly than either of our career trajectories, there were, education options that made sense for our children. So, I kind of just took a shotgun approach, and like any city that I saw kind of had schools and stuff, I like, threw my name into the ring, and I was like, okay, we'll just see what happens, and where the cards fall if I get an interview. And there were some cities where I went on interviews and, I spent like a few days there. And I was like, yeah, so I know that there's a school here, but like this is a co-ed school. So this might work for our 2-year-old, but this doesn't work for our 6-year-old, like not at this age anymore. It's one thing if it's like, a gone, but like and people are like, oh, but they're just 6. Like, it's just kindergarten. Yeah, but what about when he's 11 in 5 years when I'm finished with this? And so there were programs that, and there was one in particular in a city that now, that's why I don't want to say the name of the city because it was a program I really liked. And that city and that community has grown and exploded exponentially in the last decade. But I loved that hospital. And I was like, yeah, this is just not going to work for our family. And thank God things worked out. But, and those are kind of choices you have to make based on where you are and your family is and sort of what your situation is. But, I mean, I looked at every city in America in that way. And I was like, are there schools? Are there shuls? I mean, you start with the basics. Is there a mikvah? Is there a shul? But schools were, I mean, it wasn't even like, you can't just say, is there a shul when you have little kids? Like, are there schools for them? And are those schools where we are comfortable with our children going to school? So.
being religious definitely limits where you could apply and stuff.
Yeah, it does, but like at the end of the day, I think I really believe that there is there's a path out there for each person, and it should not be an impediment. It should be something that empowers you and makes you a unique candidate and helps kind of guide where you should be. So,
I also looked it up. Step two for surgery average in 2022, so it's a little bit behind, was 250.
okay,
And I think now they say that now that step one is pass fail, that step scores for some reason have gone up.
okay.
So, which is strange. I guess people are
Yeah.
studying it more. So,
Yeah, probably. I mean, I think that it took the pressure off because to me, I don't know how many people listening to this are like, earlier in their medical school training or who like, are like in their pre-med years, but like I mean, I found step one to be much harder than step two because step one was like Krebs cycle. Like that's all I remember was Krebs cycle. Step two had a little bit more like clinical application. And so it was things that like you kind of got a sense of and you spent time learning on the wards. And it wasn't just a repetition of the things you memorized in like undergrad and in medical school. But really that's all I remember is like memorizing things like the Krebs cycle. So and different like insertions of different muscles that I mean to this day I probably couldn't tell you and I'm a surgeon but it was like like little muscles in your hands and stuff like that. I'm like I don't know, but that was what I remember from step one, that step up to step one book. Oh, and antibiotics. So, but so it was, I mean, so it makes sense now that it's pass fail, but it was like a lot of regurgitating and I just remember sitting and memorizing all that stuff. So maybe because the pressure's off of step one a little bit, it allows people to really focus on their clinical rotations and practical applications of like real medical knowledge a little more. I don't know.
my brother's a surgeon, and he jokes that the only antibiotic he knows is Ozin.
Yeah. No, I mean Ansef. So,
He jokes about it. I think he knows more, but because when I
listen,
was
I
studying,
mean,
and all of a sudden he knows, he's like, "Oh yeah, yeah, we use that for this."
I've published a lot of things, right? Like you can look me up. I mean, I'm not like 300 publications or whatever, but like, yeah, you can look me up on PubMed, but what do you call two surgeons reading an EKG?
I don't
A
know.
double-blind study. So,
That's good.
these days I can pretty much tell you if they have systole, asystole, maybe AFib, you know.
Okay,
But if you have a hole in your heart, I can fix it. So.
that's good. That's great. Oh, how did you make time to study while being a med student and a mother?
Um, I think I mean number one, I took a train every day. We lived in Bnei Brak actually. My husband worked in Yerushalayim and I went to medical school in Tel Aviv. So to us that was sort of an equidistant point. And it was, we were like right on the border of Bnei Brak and Ramat Gan, right near a train station. Like walking distance. And so I really utilized my train time, which was it was like 48 minutes in the morning and then it was a little longer the way home because it was whatever, it was a local train instead of an express train, but like I mean it was basically an hour there, an hour back. I really used that time a lot to like prep for class and study on the way home. But it's just a matter of organizing your time and your hours, like between the hours of whatever. Like I'd come home, let's say whatever, I don't even remember anymore, but 4 or 5 or 6 p.m. and 9 p.m., those weren't working hours. Like those weren't study hours. Like those were kid hours. And then, I'd study until later at night, which meant, maybe I slept a little later in the morning than other people. But it's just sort of making sure your time is organized and, planning accordingly. And again, even going back to medical school, it goes back to all those priorities that I talked about before, where like I think my life and my lifestyle was a little bit different, being that I had kids than some of my classmates. Like, I didn't go to like I mean, for the most part, I really didn't study with various study groups. Like, I had one classmate and friend who lived not far from me in Tel Aviv, so we'd study together a lot. But like, people would have like different study groups and stuff in Haifa. Like, I went home. Like, I had other things I had to do, and I didn't like socialize. And I mean, I have good friends from medical school who I keep in touch with to this day. But like, I didn't go to their parties. Like, I didn't have time for those things because I had like two little kids. So, and that was okay. It's not like I was like, oh guys, like I have such FOMO because like I'm not able to go out to dinner with you guys. Like I was fortunate in that I had other things I had to deal with, and those were good things to deal with. And, but that was how, I mean, and also, I mean, sometimes, I mean, just like now, I mean, you saw my daughter kind of come in to ask me questions a few minutes ago. It was the same sort of thing. I mean, like, my son would sit on my lap and, like, I would study. I remember studying anatomy my first year, and he'd like play on the floor and he would draw things. And I mean, same during residency, because you're still studying in residency, I promise you. I mean, like, oh, I have all these books right here. I just don't want to like ruin the things on my shelf. But I mean, like all these stick-it notes everywhere and all these books. And you have an in-service exam every year in residency. And I mean, and I still study now. I mean, I still sit down and I read articles and I like review things for cases and I watch YouTube videos if it's something that I'm preparing for that I haven't done. And I still have PowerPoint presentations and I have conferences that I go to that I have to prepare for. And it's the same thing. Like my kids come with me to my office, they sit at a little table in my office and they color or, they do, homework or whatever. And I do my work or the same thing at home. Like they sit and they, hang out and they do their homework and I'm sitting and, doing a PowerPoint or I'm reading a medical journal. So, but I mean, you make it part of it. You make them part of it where it's not like, okay, you need to leave because I need silence. I mean, right now, fine. I mean, I'm doing a Zoom and, having, kids sit around talk and kind of add things in the background would make it hard because this is over video. But my kids come to like tons of stuff with me at work. And I mean, every time I go to a conference, and I hate going to conferences because like I don't like being away from my kids for any other nights than the nights I spend in the hospital. But like I bring one of my kids with me, whether it's Hawaii or Duke, North Carolina, like wherever it is. Like, why not? That's an opportunity to spend time with my kids at night. And I don't go to like the social things in the evenings. And they're always like, well, do you want us to order you special food? I'm like, no, that's okay. I'm just, I'm gonna kind of bow out of the evening events, and then I go out with my kids. So, and I try to like take one of my kids to each of those each time I go, and it's like special time they get with me. So, but that's how I think it just rather than kind of separating your family from your work life, you just kind of your work life is something that's just integrated into the rest of your life. Like I said that I keep them separate, and so like I'm a doctor at work, I'm not a doctor at home. But on the other hand, my kids do come with me to work. They know what I do. They're very much a part of it. All the nurses know my kids, all my partners know my kids, but I know my partners' kids too. They bring their kids to work also. And it's wonderful. I think it's just that's the era that we're in, and some of it's, maybe a relic of COVID in a good way, and some of it's just the fact that there are more women in healthcare in general. So
Yeah. Okay. There's so many questions. So I'm sorry if I'm not getting to all the questions here. All these amazing questions. As an attending, if you're in the middle of a surgery when your shift ends, do you leave or do you
no,
finish the case?
no, that's the one exception to the 7 to 7. Like absolutely not. No, like you are responsible for that patient. There's no such thing. Now, sometimes like, if there's something that happens at like 6:45 in the morning and I'm in the operating room, or I come in the next morning and one of my partners in the operating room, they'll come in or I'll come in to try to help them kind of, so it's not just a surgeon with a resident or a surgeon with, a scrub tech, like all scrub in to help them and be like, okay, let's, kind of be more efficient here because, you want them to be able to go home. Those are, but those are, I don't want to say they're few and far between. It does happen because people get appendicitis at 6:30 in the morning or get shot at 6:30 in the morning, shockingly. But that's not an everyday occurrence. That's not an every week occurrence, and for the most part, it's like, I mean, take something like appendicitis. If someone comes in with appendicitis or a bowel obstruction at 6:25 in the morning, realistically, and I don't know how many of you guys, are medical students or residents or where you are in any of this, but it's not like they're in the operating room, 35 minutes later. So they come in, you see them. We explain that, hey, we have a system where, there's a surgeon who's on call 24/7. So, I am off going in a little while. I'm going to get everything ready. I'm going to tell you about the surgery and, I'll talk to the OR and kind of get it set up. And I'll set it up for one of my partners to start after rounds because they're going to want to go see everyone between 7 and 8 a.m. or 6:45 and 7:45. And so then I'll say, hey, there's someone who came in with a bowel obstruction at 6:30. You want to schedule it or do you want me to put it on, put it on for you at 8:30 or 9, or like, what's your schedule like? And, I mean, I personally don't like when my partners put cases on for me because like, you don't know my schedule. I have like meetings during the day and administrative stuff. So I say, oh, I'll deal with it. I'll get them on and I'll swish it where I need to. Most people are the same way where they're like, I have 3 cases and I also have people I'm seeing in the office. I'll figure out a time I can schedule it. But we, that's one thing we don't do is like, when you're in the OR, you can't leave and be like, okay, My time is done. I'm clocking out. And I think therein lies the main difference between, physicians and surgeons specifically and other healthcare professionals. Like you can't clock out. You can't just walk out in the middle of a surgery and be like, yeah, my shift is done. Like that's not a thing. Whereas, in other specialties, or in other healthcare arenas, that is possible. And to me, yeah, I mean, there's it's a responsibility. Sometimes, it's onerous, but I also think it's an honor. Like it's part of like you're trying to save someone's life. You can't just walk away from it. And that's okay.
Do you have any advice, just in general, for all these, for for our participants and myself as well?
I mean, that's really broad. Like just do
I
what you
know
want to do.
it's such a any ending remarks or anything. I know it's super broad, but just getting through this, being religious, how to just in general, some advice on making it through medical school and residency.
I mean, I guess I'd fall back on the advice of our sages. I guess I'd say, I mean, it says in Pirkei Avos, "Aseh l'charav ve'uknei chaver." So, I mean, to me, my chaver is my best friend, is my husband. So, whatever that support system is for you, I mean, first of all, you really do need a Rav, because there are a lot of questions that come up, both halachic and hashkafic questions, and you need someone you can rely on for those things. But whatever that means, whatever that chevra is for you, you need a support system. You need a family. You need friends. Whatever that is for you, that strengthens you. For me, like I said before, I mean, my parents. I mean, I'm so grateful to them for, always being there for me and, pushing me when people were like, yeah, no, like, I mean, pasnished and all of that. But my husband really was my rock through, medical school and through residency. He was there every step of the way when I was scared, when I when there were bad days, when there were deaths, when there were failures, and there were lots of those along the way, I promise you. I mean, I know it sounds like, unicorns and butterflies right now, but there were lots of bad days, there were lots of failures, there were lots of in-service exams that were terrible, there were lots of performance reviews that were definitely subpar. Um, I mean, it's just it's part of the road, it's part of the battle, but make sure that you have that support system because you can't do this on an island. So,
Thank you so much. Do we have time for questions? What do you think,
yeah,
Dr.?
yeah, people can
Yeah.
ask questions. That's fine.
Um, so you guys could ask a question. Um, you can unmute and ask a question, or you could ask it on the chat again.
Or if you don't want to like unmute yourself, you can text Esther or put it on the chat anonymously or something, and
Hi, I have a question, please.
sure.
How do med students usually make money since they can't work, like while they're in med school?
Um, you don't. They don't. It's really hard to, hold down a full-time or part-time job in medical school. I mean, I guess for me, watching some of my peers in medical school, I mean, it was, I was married, right, in medical school. So I had a husband who was working full time. So it was, a different situation. But that said, I mean, looking at some of my classmates who needed some extra money, I mean, people like worked, they were like, whatever you call it, teachers assistants for things like anatomy. When we were second year medical students, they were like first year teachers assistants for anatomy. There was one guy who I know like worked in the medical school library. I don't know exactly what he did, but I mean, that's what I remember is like people kind of doing things around the school. I went to school in another country, so people were limited by having like B-Stein visas, and so it's not like you could go out there and go get a job at like whatever, like a Kosher Delight or Pizza Hut or whatever, because these were people who were foreign citizens. But I think like I mean there are some medical students who I know like do like paramedic work or EMTs or stuff like that. But for the most part, I mean, you really sort of have to spend those years focusing on schooling because if you don't and you're trying to balance that with like a job, even a part-time job, you're going to sacrifice being able to do well on your self exams and on your USMLEs. And so it was few and far between the people who worked from my recollection.
Yeah, that makes sense. I can't imagine being in med school and working. I mean, I'm pre-med, but like just thinking about it sounds insane and impossible.
Yeah.
I work as a
Thank you. Hmm.
group, not to I work as a group in a direct support professional. I just like
Wow.
but it's very substitute. I work as a sub. I worked there for 7 years. So at this point it's like going home, like it's like
Wow.
it's over the weekend. So it's really not a big deal, but it depends on the job and if it ever gets in the way. Like for me, if it gets in the way, I just don't do it. I just don't schedule my shifts that way. I schedule my shifts over the summers between first and second. But I I do it so rarely now, but I did it before for 5 years. So to me, it wasn't really working. I don't know, but I know this girl worked at Arby's I don't even know how the whole first year full time. I really have no clue how she even passed, honestly.
I mean,
Um,
for the most part, I wouldn't recommend it.
yeah, I wouldn't do it. It's not worth it.
Yeah, it's insane. It just like if you compare the hours of med school and then also doing research on the side, because here it sounds like you need to do that. How are there any hours to work at all?
Right.
Also, you could take out loans. Loans aren't too bad. Like they're bad,
Yeah,
but but failing is worse. So
right. You could
it's
take,
66. I don't even know. Some schools are 66. Some schools are 30,000. But whatever you're paying, like think about that. Like that all goes to the drain. You're making
Yeah.
the
You're gonna
most
waste that entire year or, the entire 4 years. So.
yeah, but what about like living expenses? How do people usually pay for those?
loans. So the people take loans like school,
Okay.
school costs, and then like school will also like say like, oh, living expenses will be cost approximately like I don't know, maybe $40,000 a year. So that's how much every school is different, and you could take out a certain max amount. Like I think my school is like 110,000 or something like that a year, which is a lot of money, but that's like the max. And they're like, well, this is how much you need for rent, a car, food. If you have a child, maybe some daycare expenses. So they give you a certain amount of loans that you could take out, and then you use that for living expenses.
Hmm.
Um, my brother had a kid, a whole family he had to support, and he had to take out loans and took out the max for everything. And it was difficult. He was tight. He couldn't go to Florida every, for vacation or something, right? Like, I mean, like, but they survived. They got through it. Um,
Do you find that people usually finish paying those loans by the end of fellowship if they do a fellowship?
I, I don't know the answers to those things. I'm really sorry. I mean, I think that there are JOWMA chats that are or like lectures that have been, kind of more on the financial planning aspects of it. I don't know.
Okay.
Sorry.
No problem. Thank you so much for answering the others.
Yeah, of course.
in residency, they do give some financial planning courses. I know in some places. Um, my brother still has financial loans and stuff like that. So he's still paying it off. He has a payment plan. It's not if you're worried about like medical school being super expensive and not being able to afford it, there are like things that like loans, and there's a 10-year forgiveness program which you work for like a nonprofit hospital, which in New York City, in New York, all hospitals are nonprofit. So those would work. I think like my brother's like 1 or 2 months to forgive it, to his loan being forgiven completely, but you still have to make like payments uh, reflective of your salary.
Got it. Okay, that sounds cool.
I just wanted to thank you, Doctor, and I wanted to say like how incredibly inspiring this lecture has been, and you seem to be an absolute powerhouse, which is incredibly inspiring to me. So thank you for showing that it is possible, and